Which tests are used to find osteomalacia? Imagine softening bones that become more prone to pain and fractures. That's what osteomalacia is all about. To figure out if someone has this condition, doctors relying on a mix of tests that look at blood, urine, and bones. First, blood tests are key. They measure vitamin D levels because low vitamin D is a common cause of osteomalacia. If vitamin D is low, it can mean the bones aren't getting enough mineral support. Calcium levels are checked too. Low calcium can be a sign. Phosphorus levels are important because low phosphorus often accompanies osteomalacia. Alkaline phosphatase, an enzyme linked to bone activity, is usually elevated when bones are trying to repair or grow, which happens in osteomalacia. Parathyroid hormone levels are also measured because high levels can indicate the body is trying to compensate for low calcium or vitamin D. Next, urinalysis is used. A 24-hour urine collection can tell us how much calcium and phosphate the kidneys are excreting. Abnormal amounts can point to kidney issues or absorption problems that might cause osteomalacia. Imaging tests are also helpful. X-rays can reveal specific signs like looser zones, which are small cracks or transverse lucencies in bones. These are classic signs of osteomalacia. Sometimes bone mineral density scans are done, similar to those used for osteoporosis, but in osteomalacia, the pattern of bone loss can be different. They help show how weak the bones are but don't always tell us the cause. In rare cases, a bone biopsy might be performed. This involves taking a tiny piece of bone, usually from the hip area, and examining it under a microscope. It can definitively show excess unmineralized bone matrix, which is the hallmark of osteomalacia. However, because it's invasive, doctors usually reserve this for in certain cases after other tests. Overall, diagnosing osteomalacia involves combining blood tests, urine analysis, imaging, and sometimes a bone biopsy. These tools help doctors distinguish osteomalacia from other bone conditions like osteoporosis and guide effective treatment. If you experience symptoms like bone pain, muscle weakness, or frequent fractures, it's important to see a healthcare professional for proper testing and care. Remember, accurate diagnosis is the first step toward managing this condition safely and effectively.